This is Duke University.
In the midst of this extraordinary financial convulsion which was occurring in the United States, there was simultaneously at the United Nations for 2 days at the end of last week an omnibus discussion on what we call the Millennium Development Goals, where 96 heads of state and heads of government gathered together in order to appraise the progress that has been made in achieving 8 Millennium Development Goals which were decided on by consensus at the Millennium General Assembly in the year 2000, and they were targeted for completion in the year 2015. And so the entire world got together to take a look at where we stood at this point in time. And what was interesting about it was the way in which the Secretary General and everyone else paid fevered lip service to the proposition that the goals would not be achieved unless matters of gender, matters of women, were attended to. And in fact, there is inherently and objectively some obvious truth in that. The first goal was to reduce the most extreme levels of poverty and hunger in half. And it is women who are most impoverished in Africa. They suffer the feminization of poverty as we describe it. The second goal is dramatically to reduce infant mortality rates, and obviously the relationship between young infants and their mothers, their parents, is intense. You can't deal with the infants unless you deal with the women. The third was dramatically to reduce maternal mortality rates. That speaks for itself. More than 500,000 women die in childbirth every year with a kind of demonic regularity for the last quarter century, and we've never been able to reduce the carnage. It's most extraordinary. We know everything there is to know about emergency obstetric interventions. We know about midwives. We know about birth attendants. We know about moving women who are in difficulty in labor in a rural area into a district health facility, and we have not been able to reduce the number of women who die every year in childbirth. The fourth Millennium Development Goal was to put every child of primary school age into primary school. There are roughly 77 million to 100 million children who are not in school. The great majority of them are girls. It is ever thus. It's always young girls who are excluded or withdrawn from school or have difficulty achieving an education. And when you think of these extraordinary numbers and the fact that they are barred from school in significant measure because they can't afford the school fees or the uniforms or the textbooks, or the Parent-Teacher Association fees, or the examination fees. It's a cruel and senseless business, and again it focuses on the reality of discrimination against women and girls writ large around the continent, but basically speaking around the world. If you look at the entire number of kids in secondary school in Africa, only 16% are girls. That's why what WISER is doing is so remarkably admirable, because they are attempting to create a girls' boarding school which will protect young girls from all of the predatory sexual overtures and the susceptibility to HIV and the sense of isolation and I suppose one could say marginalization of the lives they lead. And those of you who are engaged in WISER, those of you who are giving time to it, you should feel good about what you're doing, because it's a tremendous contribution, not just to young girls in Kenya, but to the mobilization of a movement in this country that has a kind of solidarity with the struggles of human vulnerability in other parts of the world. And that's a profoundly important thing. And if it doesn't happen in a university setting, where in heaven's name does it happen? And the fifth Millennium Development Goal was to turn back the pandemics of HIV and malaria and tuberculosis, and obviously the primary targets for those communicable diseases are the women of Africa. And the sixth Millennium Development Goal was the effort to approximate gender equality. I believe with every single fiber of my being that the single most important struggle on this planet is the struggle for gender equality. You cannot continue to marginalize 52% of the world's population and expect ever to achieve a quotient of social justice and equity. It's just not possible. Women are disproportionately vulnerable to the virus in Africa. Of the 23 million people living with AIDS in Africa today, total in the world is 33 million, some 23 million in Africa. 61% are women and girls. And if you look at the age bracket between 15 and 24, an age bracket encompassed by many in this gathering, and the several million people in that bracket, between 75% and 80% are young women and girls. It's like some kind of crazed Darwinian focus on one sex. And it exists, of course, because the women do not have sexual autonomy. They have no capacity within marriage, for example, to say no to sex, to say wear a condom, to negotiate safe sex. In fact, incredibly enough, one of the most dangerous things for a woman in Africa is to be married, because the levels of prevalence in marriage in many communities are higher than the prevalence of single sexually active women in the surrounding community. What's happened there is the absence for HIV-positive pregnant women to have the drugs that can prevent the transmission of the virus, and then to have the drugs that will keep them alive after they've given birth. Incredibly enough, only 30 to 33% of all the HIV-positive pregnant women in Africa at any time have access to drugs to prevent transmission. It's so soul-destroying for the women personally that they may not get the antiretroviral treatment when they need it afterwards, and that worse in their own mind will be the birth of an infant who is HIV positive when the infant doesn't have to be. The infant could be HIV negative. Kids who are born HIV positive, 50% of them die before the age of 2, 80% of them die before the age of 5. It's an evisceration of huge numbers, because there are over 500,000 infants born every year who are HIV positive, and it need not happen. I simply want to emphasize that. The kind of work that is done by students who are involved in the University Alliance for Essential Medicines, or people who are involved in WISER. These are the sort of enlightened social interventions which bring people to their senses. In the situation of vertical transmission, we have a drug, it's called nevirapine. If you give one tablet to the mother while she's giving birth, or you give the liquid equivalent to the child within 48 or 72 hours of being born, you can cut the transmission by around 50%. If you combine nevirapine with another drug, you can cut transmission by 60 to 70%. But if you do what we do in the Western world, which is to put the woman, the HIV-positive pregnant woman, on a full course of antiretroviral treatment for the bulk of the pregnancy, then you can cut transmission by 98 or 99%. Babies are not born HIV positive. Who in these environs has heard of the birth of an HIV positive child in this immediate vicinity? It does not happen in the United States or in Canada or in Europe, because we provide a full course of antiretroviral treatment. So why is the life of the woman, why is the life of the child worth so much less in Africa than it is in my country or yours? So many young girls are yanked out of school indiscriminately to look after sick and ailing parents. It's always the young girls. So many young girls are at risk at school from predatory overtures from their teachers. It's desperately sad, but it has happened in many, many African societies. So many young girls are forced to do virtually all of the work in the family. As the family falls apart, if there is an AIDS-related illness in the family, the young girls, as the women, carry the societies, and that they should be precluded from the possibilities of education is enormously painful. And therefore, everything that can be done to give them that sense of self-worth and pure relationship and legitimacy, and sometimes at least one meal a day, is a tremendous contribution. And the leading woman said to me, "What do we do with the profits, Mr. Lewis?" "Well, we buy coffins, of course. We never have enough coffins." And I look at those women and the lives they lead and the courage they have and how desperate the circumstances can be, and yet how much can be done if we provide the support and assistance which they wish. You don't have to have any neo-colonial impulses. No one is asking any Westerner to intrude on Africa with the kind of imperialist impulse which has haunted and desecrated the continent. We're asking only that you respond to the startling capacity and ingenuity of Africa itself. So you know who become the unsung heroes of the continent? The grandmothers. The grandmothers. Another dimension of women in Africa to whom such little heed is paid. These grandmothers bury their own adult children, and then at the age of 60, 70, 80, and 90, they start to parent again. There's never been anything like it. There was a study out just 2 days ago from Help Age International in the United Kingdom indicating that fully 50% of the 15 million orphans in sub-Saharan Africa, orphaned by AIDS, are being looked after by their grandmothers. And there are many countries where it's 60 and 70% of the orphans being looked after by their grandmothers. We've never had anything like this in human history. A complicating factor for everyone on the continent is the degree of sexual violence which has emerged. And I want to make it clear that the sexual violence is again a manifestation of a worldwide phenomenon, but there is a contagion happening which is greatly complicating the transmission of the virus, because where you have rape and sexual violence in aggravated situations, the virus is transmitted, and the women once again are rendered intensely vulnerable. And the gender inequality is what drives the responses, and it's gender inequality which puts women and girls at risk for HIV. And in the Congo, you've got an absolute war on women. There is no parallel internationally at this moment in time. You see, rape is no longer a weapon of war. Rape is a strategy of war. Rape is being used to humiliate entire communities through sexual violence directed at the women. And the raping continues and grows in number, as seems to be the pattern. The shooting stops, the sexual violence continues apace. And it grew to such dimension that on June 19th last, and the Security Council of the United Nations, under the auspices, interestingly enough, of the United States, a resolution introduced by Condoleezza Rice, for the first time in the history of the UN, describing sexual violence as a threat to international peace and security. That had never happened before. But what is so mystifying about it is that we don't subdue it. We don't find the capacity internationally to step in on behalf of the women. And so at the Pansy Hospital, day after day, more and more women turn up HIV positive. So I want to say to you with every ounce of feeling that I can summon, that to involve yourself in a non-governmental organization like a WISER or the University Alliance for Essential Medicines, attempting to bring decent prices accessible to all in developing countries from those who develop drugs through university research and application and patents, and WISER that is trying to create a constellation of joy and opportunity for young girls which they would never otherwise have. This is the way you build a decent and sensitive and legitimate society. And no one should feel for a moment in this audience, all of you at the various levels as well as on the ground floor, a sense of impotence or futility.
Produced by Duke University. Online at duke.edu.